We have seen a lot of hamstring patients and सबसे ज़्यादा इम्पोर्टेंट चीज़ है जो कि हम लैक करते हैं बहुत बार is return to high speed running. If the athlete was running with a very high intensity or maybe with a very high velocity, it's very difficult for him to go back again and run with the same thing after an hamstring injury, right? You do the basic strengthening, you do the basic eccentric loading, you do the basic maybe muscle recovery, but eventually, when that muscle has to go back to perform the same way as it used to do before that injury, it's very difficult. इसीलिए hamstring injuries have a lot of recurrence rate. There has been no running data available for us which can state that कि अगर इतनी रनिंग अगर हमने करवा दी हमारे एथलीट्स को ड्यूरिंग द रिटर्न टू प्ले टाइमलाइन तो वो फुल प्रूफ हो जाएगा रनिंग के लिए और हैमस्ट्रिंग इंजरी को रिकरेंस कम करने के लिए ऐसा कोई डाटा अवेलेबल नहीं है हमारे पास सो द बेस्ट वे टू यूज दिस रिसर्च पेपर बाय हिकी एट al. It was a very beautiful review by them, very comprehensive in order to manage hamstring injuries for athlete population is make them run high speed running till their 100% velocity. इसमें डिस्टेंस इतना इंपॉर्टेंट नहीं है जितना इंपॉर्टेंट है द इंटेंसिटी राइट सो डिस्टेंस के लिए देर इज अ डिफरेंट प्रोग्राम अवेलेबल बट फॉर इंटेंसिटी मे बी फॉर हाई velocity athletes it is different. The first stage is you make them run approximately 50% of their natural maximal velocity which is always known to a lot of athletes right. You go 20 meters, you gradually progress within the 60 meters of 50% intensity, and then you slow down it for the rest of the 20 meters. In stage two, what you do is you go 30% till you're 50%, and from 50% पे आप जब पहुंच जाओगे उसी स्टेज में स्टेज वन में हमें उसको 80% टच करना है और उसको सस्टेन करना है 50 meters के लिए and then you come back to 20 meters slow. So 50% 50 meters आपको 80% maximal velocity के साथ जाना है. Okay. Next is stage 3 where there is 40 meters of your stage where you have to reach 80% and that 80% or 100% का जो stage है वो 40 meters में cover होगा next and then eventually slow down 20 meters. So all of this is in relations to if the athlete gets any symptoms or if he is unable to do that. If he is unable to do that, it means that he needs more endurance training. So you have to keep them training. But अगर symptoms aggravate हो रहे हैं, symptoms फिर से reoccur हो रहे हैं कि sharp pain, shooting pain or numbness or something like that. So then you have to actually see कि क्या वो हमारा एथलीट नेक्स्ट स्टेज में जाने को है या नहीं है. You give them appropriate rest, maybe 1 day. मसल्स को 1 or 2 days से ज़्यादा देना is not very much recommended. It's like 24 to 48 hours you can always give for the muscle recovery. But if the muscle don't recover back even after 2 days, that is delayed onset of muscle soreness that is DOMS. अगर वो DOMS से recover नहीं हो पाया या maybe there is another issue for the pain, you come back to the previous stage and try to train at that stage. Don't rush it. Don't make it like कि मुझे एक ही दिन में इसको तीनों स्टेज में लेके जाना है मुझे एक ही हफ्ते में इसको तीनों स्टेजेस में लेके जाना है you have to be very slow and you have to be very progressive. So you can always read this paper, and if you don't find this paper, you can always message us and we'll provide you with the PDF. So try to make return to high speed running a very common practice with your athletes.